Top 3 fruits you must eat every morning to detox your kidneys. Hello everyone, I'm Dr. John Richards, an internist who has worked for many years in the US, where I often joke that just by stepping into my clinic, I can hear an entire orchestra coming from my patients' hearts, some beating like urgent drums from high blood pressure, some stretching out like violins from chronic kidney disease, and some humming gently like smooth jazz when health is still stable. Today, I want to talk with you about a topic that may sound dry but is actually fascinating and extremely important: kidney health, and 3 small fruits with surprisingly powerful effects in protecting us from kidney troubles. I often describe the kidneys to patients as tiny filters tucked deep in the back. They look ordinary and rarely attract attention, yet they silently filter about 50 gallons of blood every single day. That's nearly 189 liters. Imagine pouring 189 1-liter water bottles through a funnel every day without clogging. And you'll understand how hard the kidneys work. But the kidneys do far more than just filter waste, excess fluid, and salts. They also produce hormones to create red blood cells, activate vitamin D for strong bones, regulate blood pressure, and keep electrolytes like sodium and potassium in balance. In other words, if the body is a band, the kidneys are the drummer, not flashy or loud. But without them, the whole performance falls apart. The problem is, kidneys are fragile and rarely complain. Years of high-salt diets, untreated high blood pressure, uncontrolled diabetes, or casual overuse of painkillers are like constant scratches on these little filters. The scary part? Most people don't discover kidney problems until more than half of kidney function is already lost. By then, the options are not pleasant: dialysis or transplant. I always tell my patients, don't wait until the filter screams before fixing it. Care for it while it's still running smoothly. So what can you do besides regular checkups? The answer is simpler than you think. Step into your kitchen. Nature has gifted us delicious, affordable fruits that also prevent disease. And the 3 I want to share today are cranberries, watermelon, and lemon. They may sound ordinary, but behind them lies fascinating science. Cranberries, the gatekeeper. First, let's talk about cranberries, those tiny, bright red berries popular during American holidays. I like to tell patients that cranberries are the security guards of the urinary tract. Their main job is to stop bacteria, especially E. coli, from clinging to the urinary lining. Normally, E. coli sticks like superglue, leading to bladder infections and even kidney infections. But cranberries contain special antioxidants called proanthocyanidins, a big word for what is essentially a slippery spray, coating the urinary walls so bacteria can't latch on. Instead, they're flushed out with urine, like unwelcome guests escorted out the door. Cranberries also contain quinic acid, which helps urine stay slightly acidic. This matters because some kidney stones, especially calcium oxalate stones, struggle to form in an acidic environment. I recall a study in the American Journal of Clinical Nutrition showing that women who drank cranberry juice regularly had fewer recurrent urinary tract infections. Of course, I don't recommend the syrupy, sugar-loaded cranberry cocktails at the supermarket. That much sugar can spike blood glucose. Instead, choose pure unsweetened juice or simply add a handful of unsweetened dried cranberries to your oatmeal. A cranberry banana-orange smoothie is another favorite I suggest. Still, cranberries do come with cautions. People taking blood thinners like warfarin should consult their doctor, as cranberries may enhance the drug's effect. And some research shows cranberries may raise urinary oxalate in certain people with a history of oxalate stones. But for most, cranberries are a fantastic way to keep the urinary tract clear and the kidneys protected. Watermelon, the pressure washer. Now, let's turn to watermelon, a summer favorite. If cranberries are the security guard, watermelon is the pressure washer for your kidneys. I often joke, if you want to flush the pipes, don't skimp on water. Kidneys are the same. Without enough hydration, toxins build up, flow slows down, and minerals settle into stones. But plain water can get boring. That's where watermelon shines, over 90% water. Naturally sweet and refreshing. Watermelon contains citrulline, an amino acid that helps blood vessels relax, improving circulation and reducing pressure on the kidneys. This is especially good news for people with high blood pressure, a leading cause of kidney disease. It's also rich in lycopene, a red antioxidant that fights inflammation and protects kidney cells from oxidative stress. One study in the Journal of Food and Nutrition Research even noted that water-rich fruits like watermelon lower urinary concentrations of stone-forming substances, reducing stone risk. The simplest way is to eat it fresh in slices. But you can get creative: a watermelon cucumber feta mint salad, or a watermelon smoothie with lime and mint, are both refreshing and kidney-friendly. Caution: diabetics should watch portion sizes and pair with protein or healthy fats to avoid blood sugar spikes. And for patients with advanced kidney disease, watermelon's potassium content must be carefully monitored. Lemons, the defense attorney. Finally, lemons, small, bright yellow, but mighty. I call them the kidney's defense attorney because they help prevent stones from forming. Lemons are rich in citric acid, which increases urinary citrate. Citrate binds calcium so it can't easily pair with oxalate to form stones. It also directly inhibits crystal growth, meaning even if tiny crystals appear, they struggle to grow into large stones. A Journal of Urology study showed that regular lemon water intake significantly reduced stone recurrence. Lemons also pack vitamin C and antioxidant flavonoids that reduce inflammation and boost immunity, further protecting kidney cells. I often suggest starting the day with a glass of warm lemon water, a gentle way to wake up the kidneys and digestive system. If you dislike sourness, add lemon slices to a water bottle, or whisk lemon juice into salad dressings. Just remember to use a straw and rinse your mouth afterward to protect tooth enamel. And for those with acid reflux or advanced kidney disease, moderate intake is best. The Power Trio and Lifestyle Habits. Together, these three fruits form a powerful trio. Cranberries keep bacteria out, watermelon flushes the pipes, and lemons stop stones from misbehaving. But as I remind my patients, good food is half the story. The other half is lifestyle. For lasting kidney health, focus on 8 golden habits. Drink enough water daily, but wisely, not replacing water with soda or excess coffee. Cut back on salt, the #1 enemy of blood pressure and kidney strain. Eat plenty of fresh vegetables, lean protein, whole grains, and healthy fats. Control blood pressure and blood sugar regularly, the 2 leading causes of kidney disease. Exercise moderately, walking, swimming, yoga, good circulation without strain. Limit overuse of painkillers, the silent destroyers of kidneys. Sleep well, kidneys also need rest. Quit smoking, limit alcohol, both exhaust kidney function. I also encourage patients, don't wait for symptoms. Simple blood tests like creatinine and eGFR, or urine tests for albumin, can catch kidney disease early. And you can start today: a morning glass of lemon water, a few watermelon slices at snack time, a sprinkle of dried cranberries on oatmeal. Small, consistent choices make the biggest difference. A patient story. Years ago, when I was a younger doctor, I had a patient named William, a cheerful man in his 50s. He had high blood pressure and recurrent kidney stones but didn't believe diet could help. Every time stones caused pain, he landed in the hospital, complained, then forgot once the pain passed. One day, I challenged him to start mornings with lemon water and swap salty snacks for dried cranberries. He laughed. "Doc, I like beer better than lemon." But he tried. 6 months later, his blood pressure was better controlled. He had lost some weight. And most importantly, he hadn't had another kidney stone attack. He joked, "Doc, maybe I should buy you a lemon drink instead of a beer." That story taught me, sometimes the smallest changes bring the biggest results. Final thought. So, I hope after reading this, you'll ask yourself, what can I start today? A glass of lemon water? A bowl of watermelon? A handful of cranberries? Remember, the choices you make today are gifts for your future self. Your kidneys may never thank you out loud, but staying healthy, light, And out of the hospital is the clearest gratitude of all.